When patients arrive at the hospital through the emergency department, they might not be prepared, and they certainly might not be in a state of consciousness that's fit enough to be able to answer questions from hospital staff about their allergies and their medicines. And this might be vital information for their treatment or to help us diagnose what the medical problem is. They might not even be able to answer questions about who looks after their medicines. Have they got all their medicines with them? Where do they get their medicines from? Patients might not have all their medicines with them. And if they've come into the hospital via an ambulance, paramedics might have collected all the medicines in their home, which may not be ones that they're still taking, or they may have left out some medicines. Most hospital pharmacists will utilise 2 or more sources of information to get the best possible medication history. Some of those sources include the patient's carer, the community pharmacy, the GP, or the care facility the patient may be in. We've had instances where all we've known about the patient is their name and their address, and a pharmacist has spent time ringing all the community pharmacies and GPs in the area to find out the medicines that the patient is actually taking. And this is more difficult on weekends and public holidays. Sometimes in the hospital we have patients for whom English is not their first language, or who may not be able to speak English at all, and their carer may not be with them. My Health Record can help point us to the sources of information we can get about their medicines, or may even have many of their medicines listed. Of course, in a hospital we can try and get hold of a translator, but in the first instance, My Health Record could point us to the right sources of information. As we know, the My Health Record may not be the complete medicines record. Some hospital pharmacies and community pharmacies may not yet be uploading dispensing records, and patients may choose to limit access. There is some basic information in the My Health Records that we can rely on though, and that would be allergies. So it's important information that often patients don't think to tell us at first about the allergies that they've had. So My Health Record will help us start the conversation with our patients. It won't replace the communication with them, but it'll point us in the right direction to get the right sources of information. Hospital pharmacists will access My Health Record at the transitions of care. That is when a patient's being admitted and when a patient is being discharged. When a patient is admitted, pharmacists will look at My Health Record to get the best possible medication history. On discharge, all PBS medications dispensed will be automatically uploaded to the My Health Record through the Medicare section. The hospital discharge summary is a document that has information about why the patient was admitted to the hospital, the treatment that they may have had, and the investigations that they've undergone in the hospital, any changes that have been made to their medical plan and to their medicines, and the future medical management plan. The discharge summary is created by the treating medical team, and because patients might only be in the hospital for just a little while, and the GPs need discharge summary and the information on it within 24 hours, sometimes the discharge summary is started even before the patient's been discharged. Most hospitals don't have active input from a pharmacist into the medicines on the discharge summary, so they may not reflect accurately the medicines that were dispensed on discharge. There are a number of sections in the discharge summary, one of which is dedicated to medication changes and the final discharge medications. In the body of the discharge summary, there are other sections which may describe medication changes. And it is important that pharmacists look at the whole of the discharge summary to get information about their patients' medications, not just the section that has the list of medications. Knowledge about treatment changes and plans enables healthcare professionals to look after their patients' medications more safely. But just as with all information sources, the discharge summary needs to be looked at carefully.
There are a range of medication-related problems that community pharmacists see once patients have been discharged from hospital. One of the common ones is where patients continue to use medications they were on prior to admission. There's also the issue where patients ceased taking the medications they've been initiated on whilst in hospital, either because of an assumption they felt that the medication was for short-term use, or simply they weren't able to get an additional prescription for that particular medication. One of the key things that we see in community pharmacy is that patients don't bring with them a discharge medication summary from the hospital, and sometimes they send in relatives or carers on their behalf. So this can make it particularly difficult for a community pharmacist to work out what medications the patient should be on post-discharge. Additionally, patients might bring in prescriptions that were written by a GP or a specialist prior to admission, and determining whether or not those medications are still relevant for the patient can be difficult without a medication discharge summary. The My Health record provides a whole range of documents that are particularly useful for community pharmacists. For example, the Shared Health Summary provides important information regarding drug hypersensitivity that can be useful when dispensing a new medication for a patient. Additionally, the Shared Health Summary provides information in terms of what might be a contraindication for a medication that's being dispensed or prescribed over the counter by a community pharmacist. Additionally, medication discharge summaries are available on the My Health record, and that's obviously going to be very, very useful for a community pharmacist dealing with a patient who's been recently discharged from hospital. For a medication review pharmacist, the My Health record also provides very important information regarding pathology. Pathology reports, clinical data can make it very easy for a clinical pharmacist to make sound decisions regarding dosing and other clinical decisions for that patient. So patients can enter allergies, side effects, any reactions they might have experienced with a particular medication, whether it be over the counter or a dispensed medication. Additionally, over the counter medications that have been recommended by a pharmacist or a pharmacy assistant, and can also capture complementary alternative medications that have been taken by the patient. During a consultation with a patient, pharmacists can talk about the My Health record and ask patients to enter a complementary alternative medicine or a prescribed medication over the counter into their My Health record, and that helps to capture this information. It can be recommended to the patient towards the end of a consultation or at some point during that process. With respect to a patient who's been discharged from hospital and needs to be commenced on a dose administration aid, or is already on a dose administration aid, but there are changes that are relevant to it, having that medication discharge summary available on a My Health record immediately for the community pharmacist is particularly important. It allows for an efficient transition of care process to take place. We can ensure that the patient's new medications or the current regimen is up to date in that dose administration aid, and that allows for the patient to commence those treatments as soon as possible without any further complication, and that means improved compliance as well for the patient. Well, the My Health record is particularly useful and provides an abundance of information, but we do need to resort to other sources of information to provide and get the full picture as far as the patient is concerned. This might involve looking at the dispensing record and seeing what clinical intervention documentation has taken place, and that can be particularly useful. Also, speaking to the GP, as the medical records on file there with the general practitioner or with the specialist will have certainly more information than what's included in the My Health record. Talking to carers, family members will also help to fill in the gaps as far as information is concerned.
So I believe that My Health record facilitates communication between health professionals and between health professionals and their patients, but it doesn't replace it.
What it will potentially do is improve what is actually being communicated. Pharmacists will be better equipped, will be better informed about the patient, and that means that they can have a more meaningful discussion with healthcare practitioners regarding the patient's healthcare requirements and needs.